25 congregations, and you all can still do this. It doesn't have to be tied to a certain Sunday of the month, but if you want to get your church organized for faith group, my Universalist Unitarian Church did this a couple of weeks ago, and basically we're saying symbolically to sound, to ring this bell 18 times, and each ring is for 100,000 people in the state, the 1.8 million people who are uninsured in the state, and 18 people who die because they do not have affordable, accessible, high-quality health care. So we can just focus on the people who don't have health care, and focus on Representative Schock and all of our elected representatives and senators, so that they will become active and ensure that we can overcome this healthcare crisis, is that everybody can have healthcare. So I'm going to ring this 18 times, and we can just, in our own way, be silent and think about it.
The 18 is symbolical.
Each ring is for 100,000 people who do not have health insurance in this state. That's 18. It takes a while, doesn't it? Makes you think about it. I'm going to ring this one more time. And when I do, it will be in the hope that our elected Representative Aaron Schock will become a leader to help end this healthcare crisis in this country, so that everybody in the state of Illinois in this country has access to affordable health care. So maybe somewhere you'll hear this.
1.8 million people without health care in this state alone, and something needs to be done. There are people without insurance, and that is a difficult thing. 18 people die every week because they do not have health insurance. Now these figures are vague, and for those people out there, when it comes down to my family, your families, to you, to me, then it's a different story, and that's where we have to place it. What if this were me? They told me I needed heart surgery, I did not have health care. I sold my house to pay for it. That is one of the big questions that makes it very difficult. People just cannot afford it. The skyrocketing costs, the people and the insurance company, and the companies hiring them can no longer afford it. It's a major economic crisis, and people losing their jobs with this recession are losing their health care also, and without health care they're in trouble. When they go back to work again, they will probably fall under the pre-existing conditions that they will not be covered under, and this includes such things as diabetes, asthma, and some of those things that we find quite common. And sorry, we won't cover you for that, and those are big expenses to people. So this is a real crisis. It's an economic crisis for what we have. We're gathered in 5 different locations across the state for our legislature.